Nursing 402 Community Health Project Presentation by Amy Roderick, the University of Arizona Global Campus, Dr. Morella Brooks, recorded on November 24th, 2023. Community health nurses focus on improving the health of communities and populations rather than individuals alone. Millard Fuller stated, "For a community to be whole and healthy, it must be based on people's love and concern for each other." For the community health nursing practice experience, the nurse identified a community agency that helps vulnerable populations. The nurse developed an educational plan to address a health concern within the vulnerable population. The project is a small step to help the community become whole and healthy. Much of the community health nursing course was based on the leading health indicators from the Healthy People 2030 initiative. According to the Office of Disease Prevention and Health Promotion 2020, leading health indicators are objectives that can assist in improving the well-being and health of the entire population. Many of these objectives focus on decreasing risk factors that lead to many deaths and diseases in America. After conducting research, the community health nursing student found many health problems within the community, including obesity, sexually transmitted infections, tobacco use, food insecurity, and substance use disorder. To summarize the community health project, the following will be discussed: the windshield survey, the community agency that was chosen, the vulnerable population the project will benefit, the health focus that needed addressing, the educational plan that was implemented, and plans for evaluation. The astute nurse can gather much information from observing the environment and people in their surroundings. Humbles and Jones 2021 explained that a windshield survey includes observations of a community that leads to judgments regarding the community's health and those at higher risks for poor health, such as people living in poverty or with other health disparities. Taking suggestions from Rector and Stanley 2022, a windshield survey was conducted in Goodyear, Arizona, and surrounding towns considered part of the West Valley of Phoenix, Arizona. The survey was conducted over the course of several days, observing the physical surroundings, economic conditions, services available, and social aspects. Day 1 concentrated on the city of Goodyear, which, according to Census.gov 2022, has a population of 105,406. The largest percentage of people in Goodyear are white, followed by Hispanic or Latino. 98.3% of households in Goodyear have a computer, and 95.6% have an internet subscription. The community overall is thriving with new construction everywhere you look. Goodyear has several busy libraries, parks, grocery stores, and churches of many denominations. There are 2 large medical centers within 10 miles, several urgent care centers, and primary care offices. 2 large Walmart stores and Food City grocery stores are always busy and take food stamps. This community feels safe, and there are no signs of political activity other than notices for a homeowners association meeting. Goodyear is divided by a large freeway. When driving south across the freeway, the houses are older, and everything is not as nice. Similarly, poverty becomes more evident when visiting the towns just east and west of Goodyear. Unemployment in Goodyear is 4.3% compared to 6.7% in Surprise, 7.6% in Avondale, and 8.4% in Buckeye. Going in either direction down the crowded I-10 freeway, homeless people are found on many corners and intersections. Several homeless people are gathered under a bridge near one of the larger medical centers. There are no soup kitchens in Goodyear. One of the local churches hands out food boxes on Tuesdays, and there is a food and clothing bank 5 miles down the freeway in Avondale where people can get a food box or clothing. Many of the public schools in the area have testing scores that fall below the national average. Driving towards the older part of Surprise, there are large agricultural areas and a few vacant homes. Poor regions are evident, with some homes being small trailers and run-down trailer parks. Grocery stores in this area are sparse. There are no medical facilities close by. McDonald's in Surprise had a busy drive-thru. 2 men with poor personal hygiene came up to the car to ask for money, and it did not feel safe to roll down the window. The West Valley of Phoenix has many individuals at risk for poor health. The community agency chosen was a New Leaf, founded in 1971 with the mission of helping families and changing lives. A New Leaf strives to help people with complex issues such as domestic violence, homelessness, poverty, mental health challenges, and educational inequality. The agency offers services across the Phoenix Valley, such as housing and shelter, health and wellness, and programs for financial, domestic violence, educational, family support, and foster care. The specific housing center in the West Valley assists families experiencing homelessness. The center offers fully furnished apartments, case management services, court advocacy, nutrition classes, employment and financial assistance, and court advocacy. A New Leaf is a nonprofit organization supported by the City of Surprise, Arizona, and charitable organizations such as food banks and churches. A New Leaf receives money and food donations from private citizens and local restaurants. Individuals and church groups volunteer time to serve meals, clean housing units, and maintain the housing center. The West Valley Housing Center plans to add a small playground for the children. The center's outreach director stated it is always a challenge to get enough items donated when new groups of families move in. Future plans include adding more units to house more families in need. The vulnerable population that was chosen are people experiencing homelessness. Vulnerable populations are groups of people at higher risk for poor health. According to Rector and Stanley 2022, vulnerable groups include ethnic or racial minorities, those who are homeless, live in poverty, older adults, children, those with HIV, and the uninsured. A New Leaf Center offers apartments and services to homeless families with children. Chiramonte et al. 2022 stated that a leading cause of homelessness for women is domestic violence. Further, Chiramonte et al. 2022 explained that women fleeing domestic violence need assistance with mental health services, employment, and transportation, along with basic needs for survival such as housing, food, clothing, and medical treatment. Helping women flee from domestic violence situations get back on their feet and find stable housing is a focus of the New Leaf organization. Homelessness is a growing problem in America and Maricopa County, Arizona specifically. Homelessness has increased by 33.9% since 2020 in Maricopa County, accounting for 7,419 people without somewhere to live. Homelessness presents many difficulties for individuals and families for pure survival, let alone staying healthy and thriving. Hollenberg et al. 2022 explained that people with homelessness have many barriers to accessing medical care and have high rates of both acute and chronic illnesses. Barriers to receiving health services include lack of medical insurance, transportation, stigma, and discrimination. According to the Centers for Disease Control 2023, being homeless makes accessing healthcare more difficult due to both physical and mental health reasons, which leads to poor health outcomes. Implementing programs and education for this vulnerable population are essential. Many of the residents at the New Leaf Center smoke cigarettes. Therefore, the health focus is smoking cessation. The adverse effects of smoking cigarettes are well documented. Sadly, according to Tang et al. 2020, smoking rates among homeless people are 5 times the national average. Further, Tang et al. 2020 stated that 70% of homeless adults reported they smoked in 2020. The CDC 2021 said that more people die of smoking-related deaths each year than those caused by HIV, illegal drugs, alcohol, car accidents, and firearm-related incidents combined. 480,000 people die every year from cigarette smoking-related illnesses, making it the leading cause of disability and death in America. Smoking cigarettes may cause cancer almost anywhere in the body. Chronic obstructive pulmonary disease, coronary heart disease, stroke, hypertension, blood clots, type 2 diabetes, inflammation, decreased immune function, rheumatoid arthritis, cataracts, and tooth loss. Smoking cigarettes also affects babies before and after they are born, causing low birth weight, preterm delivery, stillbirth, sudden infant death syndrome, and cleft lips. The cards are stacked against homeless people to refrain from starting smoking or receive help quitting. Polvajek et al. 2020 explained that it is simply in the culture of homelessness to smoke because they may also have mental illness, substance use disorders, needing cigarettes to meet psychological needs and social interactions, along with the ambiguous nature of smoking in homeless shelters and during incarceration. Once an individual starts smoking, it is tough to quit, since nicotine is highly addictive. Odukoya et al. 2022 stated that people struggling with homelessness cannot easily access food, transportation, health insurance, or employment, which makes receiving help to quit smoking difficult. When people are struggling to find something to eat and somewhere to live, healthcare falls to the bottom of the priority list. Tang et al. 2020 explained that tobacco use is not generally addressed in homeless shelters or treatment settings, leaving this population without access to evidence-based pharmacotherapy or counseling interventions. Indeed, Tang et al. 2020 stated, the result of this unaddressed disparity is high rates of premature disability and death related to tobacco use among this vulnerable and underserved population. Developing an educational plan to teach individuals and families dealing with homelessness about the harms of smoking is a significant and worthy project for the community health nurse. The focus of the community health nursing practice experience is to implement an educational plan to improve the health of a vulnerable population. In this case, the education consisted of developing an educational brochure regarding the adverse effects of smoking and resources to help the people living in the homeless shelter to quit this harmful habit. Rector and Stanley 2022 explained that understanding the three learning domains can help the community nurse be an effective teacher. According to Rector and Stanley 2022, the three domains of learning are, first, the cognitive domain, which is learning that includes the mind and thinking processes such as remembering and understanding information and applying learnings into daily life. Next is the affective domain, learning that happens via emotions or feelings such as willingness to listen, learn, and participate. Lastly, the psychomotor domain is learning that includes physical and mental coordination such as performing skills and using sensory images. The adult learning theory may be applied to the educational intervention at the center. Rector and Stanley 2022 explained that adult learners are self-directed, draw on their lifetime experiences, and will learn more readily if the focus is on helping meet the requirements needed to live. The need is apparent for residents in the shelter to stop smoking and improve their health. The goal is for residents to learn about the hazards of smoking, the benefits of quitting, and what resources are available to help them stop. The brochures contain factual information regarding the dangers of smoking, the benefits of quitting, and resources for smoking cessation. An educational brochure was created and printed. The brochure contained information about the health effects of smoking, including smoking and death, increased health risks, cardiovascular disease, respiratory disease, cancer, and other health risks. It also included the financial implications of smoking, including current costs of cigarettes, the added costs of cigarettes, and what money could be saved and what that money could be spent on. And reasons to quit, including better health, better physical appearance, quitting for family and loved ones and friends, and also lifestyle reasons. Lastly, the brochure includes resources for quitting, highlighting the ash line that comes from the CDC and the Arizona Department of Health. Here is what the front of the tri-fold brochure looks like. Here's the back. The brochure was delivered to the New Leaf Center on November 14, 2023. The outreach director and case manager were given a presentation explaining the brochure and online resources. Education was shared regarding the health effects of smoking and free resources that are available for residents to help them quit. The brochures were placed on the resource wall in the main office of the center. Laminated posters and a resource binder were also left with the director to share with residents. Evaluation is an essential step in the nursing process. The nurse needs to know if the plans they implemented were effective and if they need to be changed or adjusted. The first step the nurse will take to determine if the educational strategy was successful is to follow up with the agency manager and ask how the brochure is being accepted. The nurse may ask how many of the brochures have been taken, if residents are asking questions, and if they know of any residents who have taken steps to quit smoking. If even one resident has registered with the ash line, the nurse will feel the program was successful. The overall experience was positive, and the community nurse hopes it will be well received. Community health nurses can positively improve the health of populations at risk for health disparities. People experiencing homelessness have an increased risk of acute and chronic health problems and have fewer resources to obtain quality health care to prevent and treat illness. Smoking cigarettes places many homeless people at an even higher risk for poor health and premature death. Creating and sharing an educational brochure explaining the hazards of smoking cigarettes along with resources to help quit can improve the health of this vulnerable population.